So, the new topic is introduction to health education. So, we are done with at least the areas concerning health promotion. All right. So, the few things that we shall discuss in health education is part of health promotion. Okay, it is a topic in health promotion. However, there are people who may have it as the course unit. It is still the same. All right, so I want to introduce you to the basic principles, concepts, and practices of health education so that we can be able to understand how we can analyze and give the community the basic skills, knowledge, so that we can be able to change their attitudes and build a very healthy community and a healthy nations through professionalisms within public health. So let's scroll down to where it's written topic, introduction to health education. There is where we start our lectures. First help me and close that. Then you need to either copy them and summarize them on your notebook. Because one of the things that is making it easy for causing poor performance is having work on the soft copy. It's very hard to read them from there. So it is good once you are revising, you copy your work into the notebook. Very, very helpful. Okay, so we have talked about health education. We've been discussing about it in the process of us discussing health promotions. We think that when you are promoting health, you need to use health education as a tool. So they have actually interchangeable relationship, whereby when you're promoting health, you use health education as a tool. When you are conducting health education, you are actually promoting health. So they have interchangeable relationship. So how do we define health education? My definition is here states that health education is a process or a way of providing learning experience that was designed to help individuals and communities improve their health by increasing their knowledge, influencing their attitudes, and changing their behavior towards better health practices. So in this case, we are not emphasizing ourselves being in the field to really do things for the people or for individuals. What we want to do is provide them, equip them with the knowledge, give them the information they deserve, and then we change by giving them the information. We believe we can be able to influence the way they react to environments in sustaining of their health and also changing their behaviors towards better health practices. The example of this could be giving them training or information about the disadvantages of smoking, how smoking can literally affect their life and their health. So by doing so, they take charge of their own health and you realize that they're able to adopt to the healthy practices. Now, according to WHO of 1998, for reference purpose, health education is any combination of learning experiences designed to help individuals and communities improve their health by increasing their knowledge or influencing their attitudes. Quite not very different from what we have just mentioned. So, it depends on, you need to be very alert when you are asked to define health education. The question may be in two ways. Pay attention to that. Number one, you may find a direct question asking, define health education, right? But again, you may find a question asking, what is health education according to WHO what definition? So there you need to have a difference. And the moment you answer a direct question on where you asked with the reference of WHO. There you failed completely, even when you asked is what correct. So, in a simple understanding, we are saying that health education helps people to learn how to live a healthy lives, how they can prevent diseases, and how they use health services effectively. Now, when we talk about the scope of health education, we are referring to areas that health education covers. Now, I say that the scope of health education is wide. There are so many things in health education. However, we pick at least most interesting and the main areas that are covered and that are very important. So the scope is wide because it covers all aspects of human life that affect health. It focuses on individual families, communities, schools, and workplaces. So down here we have the main areas or the main scopes that are covered under health education, and that should have been a table, and the table is just hidden. So we have areas and the description or the examples of those activities that are related to those areas. So one of the area that health education covers is personal health. Now, personal health here, one of the things that we can do about your personal health is teaching you about hygiene, nutrition, rest, exercise, and emotional well-being. When I talk about rest here, what I was referring to is like understanding the benefits or the importance of having enough sleep. It is actually very important because our brain, our body tend to resuscitate and gain more energy when at least we give the body the body to conduct their activity once we are already resting. The second area that I covered here is environmental health. So in environmental health, we educate people about sanitation, waste management, and pollution control. So you find that environmental health is part of the areas that are covered in health education. Then we have family, life, and reproductive health. Here we promote healthy relationship, family planning, and preventions of sexually transmitted infectious, infections, or could be sexually transmitted infectious diseases. So these are the diseases that transmit through sex. We educate the community so that they can live a healthy life and anything that related to a relationship or reproductive. And we also have the area of school health educations. So here we provide programs that teaches pupils and students about body care, safety, and disease preventions. These kind of programs can be organized and be taken to a secondary school, can be organized and be taken to primary schools. And we talked about how best they can be able to take care of their body, be safe, and prevent diseases that could be within the society where they are studying or they're in. The next things we have is occupational health at workplaces, at work, depending on what you're doing and all that. So here we promote health and safety at workplaces, for example, using or advising or demanding the employers to provide the employees with the protective gears, depending on the characteristics of the jobs they conduct, so that we can be able to prevent any other complications, injuries, accidents, and harms that are caused as a result of lack of protective gears, and as well provide preventions of injuries. And then community health, what we do there is mobilizing communities to participate in health programs like immunizations, malaria control, and HIV/AIDS preventions. Then finally, we have the scope of health service educations. Here we help people to understand the benefits and the availability of health services and how they can be able to access these services appropriately. Because when we provide services close to the community or to people, we don't expect them to ignore the users of those services. We want them to utilize the services. So as a result of that, we help them to understand the benefits and how best they can be able to access those services. So, which means there's something which is common when you're in the hospital. You find like patients are scattered within a compound of the facility. That is because they don't know how to get what they want. So you're not going to be there, and because some of them stays loitering around, and at the end of the day, they actually get back home without getting any service. With what in their mind they will be saying, I was in the facility and I didn't know what to do. I didn't know where to get what I wanted from. And they will definitely the next time they won't come back. So it's just like in a simple way giving directions on how these services can be got and encouraging them to really be able to use some of the services that they feel they can't access. We have challenges when it comes to heart services. You find like maybe there are people who send other people to go and collect for them their treatment simply because they don't want to show up in those places, and then maybe perhaps people getting to know that so and so is also on what on ARVs. So there's need to provide the mindset, changing their understanding towards that. All right. So in summary, health education deals with knowledge, attitudes, and practice related to health in all life areas. So, because the few that I mentioned, that's not all, but those are the main areas that we could talk about. Now, the questions can come on these areas whereby you can be asked to discuss the scopes of health educations with their examples. So you should be able to know when talk about personal health, what is done about that. How can you provide health educations under that area or within that area? So you take note of that. Now here we have the objectives of health educations, and here we are saying the main objectives are to group people. I mean, are grouped in three categories. We have categorized them in three phases. We have cognitive objectives, which is knowledge based. So here we provide information about the causes of disease, preventions of a disease, and how that disease can be what can be controlled. And we are saying that one is knowledge based. Second thing is to explain the importance of healthy habits and lifestyles, the importance of balanced diet, the importance of physical exercises, the importance of having enough rest, and all that. So the example, for example, teaching students how malaria spreads and how to prevent it using mosquito net. So you can do this under schools' health education. And we have affective objectives, which is attitudes based. This one basically changing people's attitudes. Here, the intention of the main objectives of this is to develop positive attitudes toward personal and community health. At least we make them to understand, change their mindset towards their personal health and the community health. And also to reduce fear and misconceptions about diseases. Because there are diseases that people tend to fear and they misunderstand it. You know, for example, one day I was at a certain church. I was invited, and when I went there, I found them. The preacher was trying to educate the congregants with. He was talking about hepatitis B, and I had him saying that the virus is spread so easily, whereby even with the handshakes, because the virus is found in the sweat. And then I senses fear in these people, the people who have gathered there. And I started seeing people shifting from one person to another. They are fearing body contact. That was creating fear in the public. Now, when you're releasing information, you must be very concerned on how people will react. Now, people's attitude has to be changed. That was the misconception. And thank God that I was a guest in that church. So when they gave me a chance to say a word, I had to clear that. I had to tell them, because I saw that reactions, and I told them that please, this virus is not found in sweat. Anyone who doesn't believe can actually make their own study, but you don't have to fear checking. hands with someone who is having hepatitis B, whether you know or you don't know, because the virus does not stay in the sweat completely. Yeah, but I made it in a very unique way that even the person who said could not understand that he made a mistake. I only said something like I was adding a point on top of that. So people's attitudes, because this kind of thing that if I allowed that people to just go like that, that was a congregation of around 600 people. I don't know what kind of information they were going to spread in the community now. So that misconception has to be discouraged. And they also made a mistake. I told them, anyway, that was after. I told them that normally when you're organizing health education at church, we appreciate that. We really appreciate that so much as public health. But it is important that you get someone who have at least understand basically how the information has to be released. You may have a right information because when it comes to health, there are things. There is what we call risk-based assessment. We look at how this information can affect the community just by fear. During COVID-19, there are people who died not because they were sick, but because they saw other people dying. Because there was a woman who was brought the facility, and when we asked what happened, they said that the grandmother was watching the TV, and then she saw how people were actually collapsing and dying in the various, and then she collapsed, and that grandwoman died. So fear, just as a result of misconception. But in other words, such couldn't be avoided. They were just supposed to avoid such a person from watching. Especially when you have high blood pressure, you must avoid things that cause fear. All right. So here, in our effective objectives, for example, we are saying that encouraging acceptance and care for people living with HIV/AIDS. Here, we want people to, at least even when someone have HIV/AIDS, doesn't mean you're not supposed to care for that person's isolating, discriminating, all that, or creating stigma. No, you can help them because this virus doesn't spread unless you come in contact with the bloods or any body fluids. The next objective we have what we are calling is psychomotor objectives, which is based on what we are calling skills. So here we help individuals to develop a practical health skills. For example, demonstrating proper hand washing or fast head techniques. Do you know that there are people who don't know how to wash hands? First, show me how you wash your hands. Show me how you wash your hands, because I don't. You might be a victim. Uh-huh. Oh, good, good. I was waiting to see your fingers entering through this, and then the scrubbing the middle here. So people just do this. I think they do this, and all that. But the hands washing is very important. So we have here importance of health education in healthcare, and which are very very important, and we are calling it. They are key components of healthcare delivery, simply because they prevent diseases and reduce burden on health facilities. Here we have importance. Number one, health education helps in prevention of diseases. How? By helping people understand causes of diseases and how to prevent them. For example, hand washing prevents diarrhea. Two, we have promotions of healthy lifestyles. It encourages good nutrition, exercise, and avoidance of harmful habits like smoking and alcohol abuse. Just give me a moment. Let me first pick promotions of healthy lifestyles. So here we encourage we said we encourage good nutrition, helping the people to understand basically the importance of balanced diet, the value of exercise. Exercise really prevent so many numbers of non-communicable diseases, including diabetes, including hypertension, including cardiovascular disease, cardiac arrest, and all that. So it's really very important to encourage the people to get involved in that, and then abandoning other habits of smoking and alcohol abuse. And the next thing is improve utilizations of health services. There we talked about helping people to understand the value of the availability, why those services are there and how they can access them. So here we're saying that people here learn where and when to seek treatment, vaccinations, and maternal care. So you don't need to wait until you are down completely before you can seek for medical services. They advise to really take actions earlier and regularly conduct medical checkup. And for reductions of healthcare costs, because the more we prevent disease, the cheaper the treatment. But when we have, because the more the nations, if a nation is suffering, carrying burden of disease, medication become very expensive for everybody because of the demand. And improving patients' compliance, educating patients to follow up medical instructions. It is very important because some of these people, you give them treatments to go and use them, but then eventually they ignore that. Or maybe someone uses treatment for 1 to 2 3 days. When they begin to feel better, they stopped. Yet the dose has to be completed after 5 days, for instance. And enhance communication between health workers and communities here through trust and corporations between the health providers and the public. It's very important so that they can be always open and discuss their problems. Now, the next things here we have is importance of health education in the community. In a community, these were the general importance. This was strictly for healthcare. Importance of health education in the healthcare, but here is in the community. So I've used a table. Now, in the community, we also have areas of economic development. What kind of role does health education play in a community as far as the economic development is concerned? Now, here we are saying that when we have healthy people, they tend to work harder. And as a result of that, it increases productivity in a community because the people are really working hard and they're working throughout days. Because one of the things that make people to really not work hard and causes or cripple productivity affecting economic development generally is sickness. Education here, healthy children attend schools regularly and performs what? Better. Social stability. Educating community, educating community reduces math, or let's say issues of misconceptions, discriminations, and stigma related to what? To diseases. When the community are actually educated, they know the right thing to do. They don't fear to to associate with the people with HIV/AIDS and all that, and that really reduces cases of discriminations and stigmatizations. In environment, it also helps in improving environment by encouraging community to clean up campaigns and proper waste disposals, and then eventually empowerment, whereby communities are enabled to identify and solve their own health problems. You don't need to be there. They know that I'm supposed to do checkups. When they get there is a problem, they get that problem being what? Being treated. So, for example, I've said here that a village health education program about safe water use and sanitation can reduce typhoid cases, allowing adults to work and children to attend school regularly, improving both health and development. So here is the summary of what we have covered there. The definition, the scopes, objectives, importance of health education in healthcare and also in the community. And then I have activity down here. You are very few, but these are instructions based on the number of students. So here you discuss one area of the scope. You can pick one of the area in the scope or in where the health education covers. Maybe, for example, school health education, and then you discuss health educations about that. And eventually, if at all we are going to that, but you make sure this is what I can say is that you're going to do revisions about those areas or scopes But this is strictly for some other time for some people that may have to do the presentation, you know. But that's all. And maybe you can write down some few questions